We are optimistic about the disease-modifying trials underway. We know that we can't silence or eliminate the Huntington gene, but we can modify the gene product. And in fact, there are trials underway doing just that. We've definitely had some negative trials it's been really tough on the HD community at large. We've had trials that looked like they were going to be effective based on the preclinical data and the early studies, the phase 1 studies, and they haven't panned out. But that's okay. We still learn a great deal from even the, quote, negative trials or the trials that don't meet their primary endpoints. So we will continue to search. Because of the advances in technology, we are farther along than we've ever been. And in fact, there are, as I said, medications that are being studied for disease modification. There are orally available small molecules that are currently under study, not in the U.S., outside of the U.S., and we are hopeful that we will be able to enroll individuals in the U.S. in the study that's currently underway with an orally available small molecule. There is also a therapy that's being studied, a microRNA interference molecule that's delivered through a viral vector directly into the caudate and the putamen, and that study is also underway. We don't yet have the final results. The study has not been completed, but again, we are optimistic and hopeful that, in fact, we will have positive results from one of the disease-modifying trials. There are several trials that are up and coming that are similar but different in their mechanisms. And so we look forward to learning more. We have learned over the past several years that there are actually other genes candidate genes and genetic modifiers, if you will, that have been identified that influence the age of motor onset and even the rate of progression. And there are studies planned to evaluate and potentially address some of these genetic modifiers. So again, we are optimistic. We're not there yet, but we will continue to work feverishly behind the scenes until we have an effective disease-modifying therapy for individuals living with or at risk for Huntington's disease.